I rise to speak on this matter of public importance, the state of maternity services in the Northern Territory. This is a deeply important issue, one that affects women, families, and the health workforce across our community. The birth of a child should be a moment of joy and hope, not a source of anxiety and uncertainty. Madam Speaker, the recent decision by HealthScope to close private maternity services in Darwin has understandably caused concern among families and health professionals. For many years, that private facility provided valued care and choice for Territorians. Its closure represents not only the loss of a service, but the loss of an option, and I know many families are feeling that very personally. It's important to understand why this happened. HealthScope, which operates Darwin's private hospital, has been open about the reasons. Over the past decade, private birth numbers have steadily declined from around 700 in 2013 to fewer than 300 in 2024. That reduction in births made it increasingly difficult to keep the service financially viable. There were also local workforce shortages, particularly in experienced pediatricians and senior midwives, which made safe and consistent staffing more difficult. Added to this way, rising operational and compliance costs from locum expenses to insurance and indemnity requirements. Taken together, these pressures led to commercial judgment to close the service. While we may understand the reasons, that does not make it any easier for the families affected or for the staff who have dedicated years of their careers to supporting Territory mothers and babies. Madam Speaker, I want to take this moment to acknowledge and thank the midwives, nurses, doctors, and support teams at the Royal Darwin Hospital who have stepped up in recent months to meet the increased demand. The transition has not been simple, but the dedication of the team at RDH has been outstanding. I have worked at Royal Darwin Hospital myself, and I know the caliber of people who serve there. They are compassionate, professional, and deeply committed to their patients. As someone who has spent much of my professional life in health, I also know the emotional load that comes with this kind of work. I was trained as both a registered nurse and a registered midwife in India, and while I'm registered in Australia as a registered nurse, my heart has never left the practice of midwifery. It is one of the most challenging yet rewarding areas of healthcare. It is about bringing new life into the world, about care, reassurance, and trust. As a parent, I have experienced this personally too. My own child was born in Darwin Private Hospital, and many of my friends, neighbors, and constituents have had their children at Royal Darwin Hospital. The stories I hear from them are filled with gratitude for the skill, compassion, and dedication of the staff. They speak not only of excellent clinical care, but of human kindness. Mr. Deputy Speaker, we all recognize there are real challenges in the health sector: workforce shortages, the high cost of recruitment, and strain on services in a growing population. These challenges are not unique to the Northern Territory. They are being felt across Australia and indeed across the world. But what matters most is that this government is taking action. The Minister for Health and the Royal Darwin Hospital leadership team are working closely to ensure that transition following HealthScope decision does not compromise the safety or quality of care for mothers and babies. Our government is committed to supporting the staff, strengthening public maternity services, and looking at long-term solutions. That includes exploring ways to rebuild private maternity care in Darwin. Territorians deserve choice, and we know that private and public systems can complement each other. A balanced model provides flexibility for families and helps to relieve pressure on the public system. We must continue to create an environment where private providers can operate sustainably, where they are supported by strong workforce pipelines, training programs, and local recruitment initiatives. Mr. Deputy Speaker, this is a time for collaboration, not blame. The opposition has raised this matter, and that's fair. But we must all recognize that finger-pointing will not solve the issue. Supporting mothers and babies requires teamwork across government, the health sector, and the community. The government's focus is on solutions, on listening, acting, and strengthening the system. To our nurses, midwives, and doctors, thank you. You have shouldered an enormous task with professionalism and grace. To the families impacted by these changes, we hear you. We understand that this is not an easy time, and we are working to ensure you continue to receive safe, high-quality care. Mr. Deputy Speaker, as a nurse, as a trained midwife, as a father, and as a member of this House, I believe that every territory mother deserves the best start for her baby, every midwife deserves support, and every family deserves care they can trust. This government is standing with our health workers and with our families to ensure that new life in the territory continues to begin with safety, dignity, and hope. I commend the government's ongoing work, and I thank all those who continue to serve in this vital area of care. Mr. Deputy Speaker, I just want to take on a couple of points from what we discussed in this chamber earlier. There was a discussion around like casualization of the workforce. I worked with the ND Public Service or ND Health for nearly 10 years, and I worked in the senior leadership role as well in the last 3 to 4 years of my career. All I can say is about like there were like nearly 30% of full-time vacant positions in the area that I used to oversee in the psychiatric area, which was similar in the other areas as well. So I don't think where the information is coming about like the government is trying to casualize the workforce, that's one of the reasons. That is not the reason. The reason is we can't attract trained or skilled clinicians and staff members to the Northern Territory. And I know that it is easy to say that we need more staff members, we need additional clinicians and skills and supports. There is a environment that we need to provide for increase the population as well. That's why this government has these three key pillars about the reducing crime, rebuilding economy, and restoring lifestyle. I know that many see that we are repeating that again and again. There is a reason why we have these three key pillars, and the reason is once we reduce the crime, it will improve how people feel about the territory. They feel safe, and the people who are here in the territory will not leave the territory because of the crime issue. And once we delivered on the rebuilding economy, which the Chief Minister and the Treasury is working really hard on, so once we have the economy to flourish and move forward, again, like the teenagers and the uni students that's currently here, they're not going to leave out of the territory, so we can retain them. And we clearly see about the issues with the hospital delivery of the numbers that's dropping over the last 10 years from 2013 to 2024. And one of the issues is around the affordability. An ordinary individual with, even if the 2 members of the family is working, it is hard to afford. So there are various factors, and the last one is the restoring lifestyle. So the reason why the government has the 3 key pillars, and we all are working on that, because we are sure with these 3 key pillars, if we are going to address, we can address this population issue, we can have like a flourishing economy, and we can have a really good lifestyle, which will attract and retain the skill force that we needed, and that won't be an issue for the health system probably in future. But again, like at this point in time, what we need to do is about like us government, we will support the Minister for Health, because he's doing a great job and advocating for us in Canberra. And as we discuss here, we need like all the levels of government want to work together. We need the strong voice of our federal representatives in Canberra as well. There is always good to blame each other in politics, but when it comes to the matters like the health, we need to make sure there is bipartisan approach, and we stand by with Minister Edgington and Minister for Health and with the NT Health. And I just need to once again thank all the hardworking clinicians in the front line and making sure that they are providing that service for Territorians at the front line where it's needed. Thank you, Mr. Deputy Speaker.